This is Dr. Mayberry, and this is our axial skeleton lab discussion. The axial skeleton includes the vertebrae. You have cervical, thoracic, lumbar, sacral, and coccygeal. It includes the ribs and the sternum. It also includes the skull, but we will be doing the skull on a separate lab in a separate lecture. So you are looking at all of this except for the skull right now. So the first thing you need to know are the different types of vertebrae. So you have cervical, those are basically your neck. Your thoracic is like the vertebrae that are part of the rib cage. The lumbar is your lower back. Sacral is part of your pelvic girdle, and coccygeal are your vestigial tail. So we have 7 cervical vertebrae. So we say we have breakfast at 7, you have 12 thoracic, you have lunch at 12, 5 lumbar, dinner at 5. Okay, there are different ways to remember it. Some people say cereal at 7, tacos at 12, lasagna at 5, and then a snack at 5 as well. Whatever. As long as you remember 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, and usually people have 4 coccygeal. That one is a little bit more variable because that is the vestigial tail. It's not really serving an important purpose. You can have variable numbers. Some people have extras. Hemivertebrae are more common. That's sometimes a cause of scoliosis, so you have like little segments of vertebrae that are extra, but this is the standard for humans. So you can see the anatomy of a single vertebrae here. We will talk about this when we do the landmark discussions. And you can see that you have intervertebral discs between the bodies of all of your vertebrae. These are very important for mobility in the spine. Without the intervertebral discs, you would have more fractures in your vertebrae because they absorb shock, but they also allow movement between the vertebrae. So this is really important. And then this neural arch that houses the vertebral foramen here, this vertebral foramen is where your nerves are coming down from your brain. So that's your spinal cord in there. So that is very, very important. It is, really the main function, or one of the main functions of the vertebrae are to protect your spinal cord. So that's what's going on in there. The first 7 vertebrae are cervical. C1 and C2, the atlas and the axis, are more different than any other vertebrae in the spine. The atlas is the first cervical vertebrae. It is articulating with the skull, but with the occipital bone of the skull. So the foramen magnum lines up right here with this vertebral foramen, and your brain stem really is starting to come down here and turn into your spinal cord. So C1 right here. So C1 does not have a body. It's really bizarre looking. C2 has a body, but it also has this dens that sticks up like a little head. The dens articulates right here in this fovea, which is the fovea for the dens. So you can see how they articulate. There are evolutionary hypotheses that these used to be one vertebrae and they've separated, which allows more mobility for turning the head. We talk about stuff like that. So C1 and C2 are different, but that means C3 through C7 are all vaguely similar looking. Cervical vertebrae tend to have bifid spinous processes that you can see here. The most recognizable aspect of a cervical vertebrae, meaning every cervical vertebrae has this, are these 2 little holes on either side of the body. These are the transverse foramina or transverse foramen. They are important. They protect the vertebral artery on its way up to the brain. You only have them on cervical vertebrae, which means if you see these holes, you are looking at a cervical vertebrae. So that's the best way to recognize what you're looking at. They are a little differently shaped than the rest of the vertebrae. The bodies are a little bit smaller. So we say that cervical vertebrae look a little bit like fox when you look at them. I don't see the fox a whole lot, but some people do, so do they look like a fox to you? I don't know. But those transverse foramen are the best way to recognize a cervical vertebrae. The thoracic vertebrae, there are 12. They all have costal facets, or facets for the ribs. They do not have those transverse foramina. The way to recognize them is that costal facet. because costal means ribs. So these are articular facets for the ribs. Each body has a demifacet, so you can see here the rib attaches to two vertebrae here. So they have little bitsy demifacets on the superior and inferior aspect on either side of the body, and then they have another facet on the posterior aspect of the transverse process. So those are what you look for when you think a vertebrae is a thoracic vertebrae. We say that thoracic vertebrae look like giraffes. I see the giraffe, totally see it. So, check that out. The lumbar vertebrae, there are 5. They look like mooses. Moose. So they are bulkier, as a moose is bulkier than a giraffe. The bodies are quite large. They're supporting basically the whole weight of the body as you move down. We say that the spinous process is hatchet-shaped. The transverse process and the articular facets for the superior and inferior vertebrae are sort of shifting. They're more posterior now, so they are very different looking, though they don't have this distinguishing feature like an extra facet or an extra hole or anything like that. But they are quite distinctive looking. Then you have the sacral vertebrae, which fuse into the sacrum itself. When we talk about aging, we'll talk about fusion of the different sacral vertebrae. You have the sacral foramina in there. So this is the sacrum. It's the sacral vertebrae. The coccyx, or the coccygeal vertebrae, is inferior to the sacrum. It's usually 4 vertebrae. It's that vestigial tail, so it's the last of the vertebrae. You just have to be able to recognize it. Here are those intervertebral discs. They have a couple of parts to them as well. The center portion is sort of squishy. We call it the nucleus pulposus. Nucleus is in the middle. Pulposus, it's pulpy. The annulus fibrosus goes around the outer edge. Annular, a ring is annular, so it's a circle. It's fibrous. It's protective. It contains this nucleus pulposus. So you can actually get a little tear in there, and the nucleus pulposus can sort of pop out a little bit, and that's, causes you pain and when it runs into your nerves and stuff. So this is, very important that it is structurally sound. But this is allowing us flexion. The nucleus pulposus absorbs shock, so this is really important. Here are the different directions that your spine move that are facilitated by those intervertebral discs. You can move side to side, you can spin, you can bend around, you can stand up and do some of this, especially if you're in a public place. It'll be highly amusing to the people around you. You do have natural curvatures in your spine. So you're born with a kyphotic curvature, and that's this anterior curve. But as your muscles develop, as you move around, it's important that babies, they say they have tummy time, and that helps build up the muscles that allow for these secondary curvatures, which are lordotic. So those are curving in the other direction. So you have an S-shaped spine, meaning you have a few different curves in it. And this allows us to have erect posture, that whole bipedalism thing. It gives us a balance, a center of gravity, which also helps with bipedalism. So the curves in the spine are critically important for mobility and balance. So now we look at the ribs. I told you how they articulate with the vertebrae in the thoracic vertebrae slide. You can see the head of the rib articulates with the body. This articular tubercle articulates with the transverse process, and then it curves around, and in the front is the sternal end. So you have 12 ribs. There can be some variation. Some people have 13, some people have 11. The standard is 12. Most people have 12. Ribs 1 through 7 are called true ribs. 8 through 10 are false, and 11 and 12 are floating. So what this means is that 1 through 7, when the sternal end is in front, they will have a costal cartilage that binds the rib to the sternum. So 1 through 7 all have their own costal cartilage. They are true. Ribs 8, 9, and 10 share costal cartilage. So they all attach to the same costal cartilage, or really the costal cartilages fuse before they attach to the sternum. and that's what makes them false. So they share that costal cartilage. Ribs 11 and 12 don't have costal cartilage. They are floating. So the back part is, hopefully, obviously, still articulating with the vertebrae, but the front part does not in any way articulate with the sternum. So we call them floating, though the back part is attached. The head is attached. So true, false, and floating. Oops. Here's that sternum. So you have the clavicular notch up here. This is the manubrium, the superior portion of the sternum. It's often a separate piece, though it does fuse later in life with the rest of the sternum. So you have the clavicle articulating at the clavicular notch. This is the costal cartilage of the first rib. So the first rib is like over here, and that cartilage attaches there. And then here are the costal articular facets for the other ribs down here. So rib 2, 3, 4, etc. This is the sternal body. We call it sternebrae in younger individuals because they actually are separate and they fuse throughout life. And then we have the xiphoid process down here, which in many people actually never fuses. If it does fuse, the individual is usually quite old. So the xiphoid process is this little dangly at the bottom. So this is the sternum. Here you have the thoracic skeleton. So you can see here's a macaque, a monkey. Here's a gibbon, which is a lesser ape. Humans and chimpanzees are great apes. I put this on here so you can really see the difference. Even though we did the innominate with the lower limb, you can see how they're differently shaped. You can see how the spine is differently shaped, the rib cage is differently shaped, even the sternum. All of that is different, and it's all to do with mobility for the most part, evolution. So we already talked about placement of the scapula. That changes as well. But I just want you to see that though the bones are effectively the same, the shape and therefore the muscles that are attaching to them are different. So this is sort of just a snapshot of that thorax right here. You have your ribs, your sternum, your thoracic vertebrae, and then even parts of the upper limb, the clavicle and the scapula. So take a look at these. So that sums up our thoracic skeleton. So proceed on to the skull lecture when it is time, and make sure that you're studying your landmark lists and all of that.